and the 15th Mission on Health, Honorable Joseph Sawambi, the Chairman, House Committee, and members of the legislature, the Honorable Mayor of Pinsville and other government officials, Dr. Peter Clement, Fellow of the West African College of Physicians and World Health Organization representative to Liberia. He is the annual lecturer for J.N. Toba Lectures Series. The President and Faculty Head of the Liberian College of Physicians and Surgeons, members of the Diplomatic Corps, the J.N. Toba family, our special guest, Professor Sunny Chineye from the University Teaching Hospital, Port Harcourt, sister colleges, the West African College of Surgeons, the West African College of Nurses, the West African Fellows, members of the West African College of Physicians, invited guests, ladies and gentlemen. On behalf of the West African College of Physicians Liberian Chapter, it is my humble duty and privilege to warmly welcome you to our 6th National Annual General Scientific Meeting, AGSM, and also the 15th J.N. Toba Memorial Lecture. On October 23rd, 1976, the Liberian chapter, along with the Gambia, Ghana, Sierra Leone, and Nigerian chapters, were the first 5 chapters that joined hands together to form the first West African College of Physicians in Lagos. And it was formally inaugurated. Since joining the college as a small chapter in terms of numbers and of our fellows and members, in Liberia, we have remained very strong, committed, thereby encouraging the younger doctors into the program for specialization. I'm pleased and honored to recognize and inform you that during the 44th and 45th AGSM, from our chapter, we had 2 candidates in the Faculty of Internal Medicine who were inducted as fellows of West African College of Physicians by examination. They are Dr. Ian Wachukwa and Dr. Philip Z. Ireland. The West African College of Physicians by election were also inducted, and they inducted Dr. Peter Clement, WHO representative, Dr. Musu Julie Duwoko, Community Medicine, Dr. Titi Kowoi Brooks, Dr. Gabriel Kidan, Medicine, Community Medicine, and Dr. David Okiro, Family Medicine. The other members who were inducted as members into internal medicine were Dr. Emmanuel Kiniba, Dr. Joyce Machikwa, Dr. Yasa M. Barclay Kowoi, and other members were Dr. Benetta Andrews, Dr. Charles Ogoni, Dr. Nuta Balon, Dr. Maimake Bisa, Dr. Patient Franklin, and Dr. Ya Nema, Dr. Hawa Kun, as well as Dr. Mini Sankawolo Riggs. From the Faculty of Laboratory Medicine, we had only one candidate, Dr. Zebulon Patel. He was inducted as WACP member. We congratulate all these new members who were formally inducted in the last meeting. We continue to encourage our young doctors, and I have the honor that 3 members this year were able to take their exams, and all 3 of them passed and became new fellows. They will be formally inducted. They made Liberia so proud because we had 100% pass rate of the West African College of Physicians by examination. The new fellows are Dr. Joyce W. Dr. Emmanuel Ekeniba, Internal Medicine, and Dr. Charles Ogoni, Pediatrics. We congratulate you as you become new fellows, and you will be inducted at the regional meeting. The West African College of Physicians, the Liberian chapter, as you know, have given special recognition and appreciation to the training of our faculty members. And this is no small feat. We want to highly recognize and appreciate all the doctors, visiting professors, all who have guided them, trained them, corrected them, motivated them, and mentored them into becoming fellows. They sacrifice a lot, and they work beyond the call of duty to get Liberia on the flying colors and to get Liberia on the map of fellows. One of such member of visiting professor is here with us as our special guest. Is none other than Professor Sunday Chineye. At the appropriate time, he will be properly gowned. The other visiting faculties who we are appreciating for their hard work are Dr. Mukhtar Adeza, Professor Oladimeji Deji Ajayi, Professor Fidelis Nkojama, Dr. Magdalene Odund, Professor Clement Ezechukwu, and Dr. Fidelis Njokama. Even though Liberia is a small chapter, as you can see, the fellows and members in this chapter have worked very hard and to raise and also to the public through press releases, news items, so that the public will get to know what to do and how to help themselves. The scientific meeting serves to guide and to advise the national government through the Ministry of Health on ways to address the Liberian health challenges for a healthy nation. We are happy to note that this year, J.N. Toba lecturer is none other than the WHO representative, Dr. Peter Clement, who is not a stranger to us. The chapter is grateful to the government of Liberia through the Ministry of Health for the cooperation and support received. The J.N. Toba Memorial Lecture is an annual event organized by the Liberian chapter to honor our late Professor Joseph N. Toba Sr. for his numerous contributions to the medical education and healthcare delivery service in Liberia. Hence, beginning in 2017, fellows and members unanimously decided that J.N. Toba Memorial Lecture Series be part of our national AGSM. The theme for this year's AGSM is Rising Prevalence of Non-Communicable Diseases under the Threat of emerging and re-emerging infectious diseases in Liberia. The theme was selected because Liberia has been struggling to control serious infectious diseases like Ebola, Lassa fever, and for the past 8 years, when we had one of the worst Ebola epidemic in the world. We lost over 20,000 deaths, including 20 health workers. We are now handling COVID-19 pandemic, and with all of the infectious diseases, the country has additional burden of the rising number and prevalence of non-communicable diseases. The non-communicable diseases are silent killers, and the prevalence has caught up with the infectious diseases. In Liberia, with our limited resources, we need a clear strategy to handle both the infectious diseases and the non-communicable diseases efficiently. Hence, this year's topic is very important to help focus activities that will strengthen our health system and improve our national and global indicators. In a practical way, exactly 1 week ago, the Faculty of Internal Medicine conducted community outreach services to the Dwaza market and treated over 200 patients free of charge. Many of them were diagnosed with one or more non-communicable diseases. They were able to provide health education to the marketeers and also treated them and their children, who some of them were referred to JFK for further treatment. We would like to thank in a special way the Faculty of Internal Medicine for such humanitarian and much needed services to save life in the country. Thank you, Faculty of Internal Medicine. We are very happy at this AGSM because there are a lot of good things that have happened to our chapter. Even though it's small, it's growing bigger and stronger. We have a lot of good things, and we are becoming very strong. As I said before, we are rejoicing with our 100% pass rate, and in due time, we will call them forward to be recognized. We are so excited and would like to say congratulations to our President-elect, Dr. Rose Jala Macaulay, who will be she will be inducted at the regional body early November at the regional meeting of AGSM in Accra, Ghana. Once again, let me wholeheartedly welcome you all to our 6th National Annual General and Scientific Meeting of the West African College of Physicians Liberian Chapter and the 15th J.N. Toba Memorial Lecture Series. Thank you for coming.
For hosting this year's AGSM. As our chapter chair and vice president said, the Liberia chapter is considered one of the smaller chapters, but they always call our chapter the dynamic small chapter. Dr. Liz has specifically asked me to congratulate the chapter for the 100% pass rate of the fellowships exam this year from the Faculty of Internal Medicine. We also want to congratulate the Faculty of Pediatrics for the first fellow by examination in our chapter. And in my own way, I just want to say, you young people, you are the torch bearers. We are on our way out. My professor and mother always say, we have one foot in the grave and the other foot have no business running around here. If you don't do it, nobody's going to do it. The only way you can continue to hold the Liberian flag up is what you have done this year. and we know you can do it. If there is anything that you need that we can do as a chapter in our way to encourage you, we are here to encourage you. We want you to continue. To other fellows, you know there are rules and regulations in every game. And the game of being a fellow and a member of the West African College of Physicians, there are no exceptions. There are certain things that we must all do. We know that this college is no longer is to be supported by the member governments. But as we know, that is not happening. So they hold all of us responsible to make our meager contribution by paying our dues and being financially online. You will not be invited to many of the college activities. So I'm encouraging all of us. Our chapter is already small. So what we can boast of is the proportion of us who are financially stable in the chapter. It's not a number, but a proportion of us. So I'm encouraging you, whatever you can do, make sure you make your contribution to the building fund that is coming up, that is here, and we all have to contribute. But now to my young members and those who are yet to be members. If these three people can do it, you can do it. There is nothing that will hold you back. The earlier you do it, when you are young, the better it is. If you put me on that floor now to say, do the crack the patient, you will see how many steps I will miss. But my case, I didn't miss one. So do it while you are young. Don't wait. And do not let the younger ones come after you and do it while you are waiting. So please be encouraged. There is nothing that should stop you. All others struggle. You are not alone. If you notice, the percentage of pass from our local chapter is higher than the percentage of pass in the bigger chapters that we look up to. So it means you can do it. And I'm just here to encourage you. So and I'm saying, when I become your president, you have to keep me proud. I want to have, by the time I step down, we must have fellows in all faculty in Liberia. Thank you very much. Again, congratulations from the president, the executive, the secretary general, and all members of the SO of the WACP. And I'm here, congratulations. Thank you.
Recognize everyone, especially members of the health community. We praise God for each of you and thank you for your great work. We bring you greetings from the over 600 esteemed nurses and midwifery leaders from Gambia, Ghana, Benin, Cameroon, Nigeria, Sierra Leone, and of course Liberia, who are all members of the West African Postgraduate College of Nursing and Midwifery, formerly the West African College of Nursing. In the West African College of Nursing, it is a body from WACP that is responsible for ensuring education, practice, and regulation of nursing and midwifery in the region. In the region. And in our college, we have 5 faculties. And we are very pleased that we have me as the president for the region here with the Liberian chapter. And we have 2 representatives. We have Shirley from the college, what we call the famous Faculty of Administration, Medicine, Management and Education. And we have Harriet from the maternal child faculty line, my faculty. Yes. And so we have the other colleges are the medical surgical college and the community health college, as well as the mental health, the faculty of mental health nursing. We are here especially today, like we say, to recognize and celebrate with our sister college, the College of Physicians, because we recognize them as the leaders in this team that's going on in the world. We have all these emerging diseases, infectious diseases that are happening, and like you see on the team, the rising non-communicable diseases. And as you will see in the scientific sessions, they are putting emphasis on those, as was referred here earlier, as the silent killers. We all know that now, besides the COVID, we're like so worried about the COVID. And we all know that besides the COVID and besides our whole concern about our increased maternal and newborn mortality, we see that our next coming in line are all these non-communicable diseases. And the thing about them is that the mortality is there, like we say, we're having a lot of people dying, but the mobility is the real problem. You have all these people with stroke, with blindness, with amputations of arms and legs. All of these people are due to these non-communicable diseases that we see are simply increasing and increasing daily. So we want to really thank the college for the team, and we pray that the scientific session will help all of us to get new information that we can continue to work with. We cannot leave without paying special tribute to Dr. Tupa. I used to call him our most famous physician in the world. He was a physician that recognized the entire health team. And so he knew that each side of it has something, which is also something that the College of Physicians here in Liberia always put with, like I'm not forgetting about us. And so as we recognize Dr. Topa today, we hope that we will all continue to work as a team. We also know that one of the things he completely promoted was the public health, community health. In the West African College of Nursing and Midwifery, we now have what we call the Community Health Initiative. And that Community Health Initiative is making sure that nurses and midwives work with communities to make sure that they can look at whatever diseases, especially those medical surgical conditions. They will look at maternal child health, and they can look at mental health. That nurses will move further and midwives will go beyond the bedside, because we know that the only way we will get to universal health coverage is if we have the community initiative. So we want to pay special thanks and appreciation to all of you for being here, and we congratulate especially the incoming that passed by examination. And it's an encouragement to the other colleges, like we go to the fellowship, we will see the Nigerians have been able to pass, or the Cameroonians. We want to make sure that Liberians also, in a postgraduate college of nursing and midwifery, will also be able to get those fellowship by examination. So we want to thank you, and we wholeheartedly congratulate you. We pray best wishes upon you during this
scientific session. Thank you very much.
To continue to lead us. And in this manner, the West African Postgraduate College of Pharmacy is struggling with the postgraduate fellow by examination of November next month. We will have our examination be administered, and it is hopeful our colleagues will be able to make a successful pass. This is a way of following your steps, and we celebrate you. We want to pay homage to the Tuba family. And sometimes when I think about the Tuba family, it makes me to wonder, tomorrow when I shall have left the shores of this planet, what will be my legacy that people will remember me for? And I thought to myself, one thing I will try to do is to replicate myself, because I feel within my soul that anybody who lives and fails to replicate herself or himself, you have become nothing. And this is why I've decided to spend the rest of my retired life in the field of teaching public pharmacists. I came late this morning because I had a class to teach in parapsychology. I had to go there to teach the class to fulfill my obligation. So we are following your step carefully and meticulously.
Yes, sir. Yes, sir.
Let me say this. You have chosen a very important team for this scientific symposium. The rising prevalence of non-communicable diseases, on the threat of other diseases and emerging diseases. It looks like nature is not insensitive with us. While we face the threat of communicable diseases, we have to face the threat of non-communicable diseases. Let me tell you, for my own experience in my own church, my very important member of the church, the praise leader, one day she was conducting a praise service when she was knocked down by pressure, and she is there right now. So it's a common knowledge that we are overtaken by non-communicable diseases. And having this at the back of our minds, the pharmacists, your counterparts, are doing all that it takes to arm ourselves with the requisite knowledge. Just yesterday, I was on an online program offered by the West African Postgraduate College of Pharmacy to look at emergency care. You see, there's a paradigm shift in the pharmacy training now. We are shifting from product-centered pharmacy practice to patient-centered pharmacy practice. And that's why we are working assiduously to prepare our students for the Doctor of Pharmacy degree. I'm especially delighted to be a part of that process. And I always told my colleagues, I call my students my fellow colleagues. I say you are a pharmacist until you prove yourself otherwise. So I call them fellow colleagues. It is not sufficient for me for you to be called doctor of pharmacy, where it is signal. But what is expected good for me is for you to demonstrate and perform to the expectations of your clients, to the expectation of the profession, and the expectation of the global village. We are interconnected, and we must do what it takes to be on par with all that is set before us. Something has to be done. We are celebrating for you to do an important job with satisfaction. You must be able to cater to your family. So as we celebrate and we emphasize our collective effort to tackle non-communicable diseases that is plaguing our society, it is important for us to pay attention to people that are in a vanguard. And let me tell you, fellow colleagues, that the pharmacist will no longer be the backbenchers. They will no longer be the one to stand and watch the show. We are preparing our colleagues in a manner to be truly partakers and facilitate the process of caring for our people, caring for the sick. So it is important in this current manner that something has to be done to encourage them. This whole, and as I take my seat, I want to extend an invitation to you distinguished people. March 20th to 23rd, we'll have the 35th Annual General and Scientific Conference of the West African Postgraduate
West African College of Surgeons. West African College of Surgeons.
I don't know whether I need this because I'm a member of a sister college that is a twin of a sister college that was delivered 15 years ago, but that twin is still in utero. My college, the West African College of Surgeons, Liberia chapter, is a college of obstructed delivery. I am here in two capacities because the younger ones could not come and say sorry and apologize for their delinquency, so they decided to bring the old man to do it for them. I shall not hesitate to do that. Your sister college, the West African College of Surgeons, Liberia chapter, is a delinquent, dormant, sleeping, noise-making, and silent sister. But I am here to bring greetings to you nonetheless. We have all promised and we have all decided that enough is enough. We shall come either by natural process or we shall be delivered by C-section. And because they have not decided all this time to come by natural process, they have chosen me, the oldest member surgeon among them, to do the C-section to deliver us. I therefore greet you on behalf of your sisters that are somewhere around there wishing, wanting to come out. The country representative that has done a solo job, magnificent. He has led and done almost everything for this chapter, represented us in 3 annual conventions with excellence at the highest level, but could not lead us at the local level. I therefore commend you, fellows of the West African College of Physicians, Liberia chapter. Though you are small, but you are great. Though you are few, you have done a Herculean job. And though you are young, you have left imprints on the sense of time that we who are dormant shall finally open our eyes to find those footprints so that we may follow in your footsteps. It is not only the salutations that I bring you commendations and celebration for what you have done. You are few in number, and from one of the countries of the sub-region that for some strange reason, because our numbers are always small, they tend to overlook us. When the Nigerians look at us, they say, where is Liberia? And now and then when I have the chance, I tell them, we were there when you were not even thinking about coming. The Ghanaians, they think they have all the protocols. But I tell them, we flew the flag. And in so doing, you shall be people who will bear the light that others will follow. Though glimmering and small, we shall not lose the brightness of that light. You rekindle the light of professionalism, scholarship, research, conferencing, and self-exposure in this country after our horrific mistake of the Civil War. And we thank you for doing that. You are the ones who are leading and leaving footprints on the sands of time, and we hope we shall follow in your footsteps. You have woven an agenda of activities at the local, sub-regional, regional, and continental level, and we hope we shall look at what you have done and copy, even if we have to spy from your of honoring your teachers, respecting and celebrating your colleagues, because in so doing, you shall yourselves be honored, and I can tell you, you are the most honorable professional group, as far as I know, in Nigeria. Chapter. I have a college who doesn't like that. I will say it again, lunch. You have not done anything for anyone to see what you are doing. But we intend to do it. Come March this year, we shall launch the reorganization of that chapter, and the first lecture that shall be the twin brother to the Togo Memorial Lecture shall be delivered, because Liberia College knows that eminent surgeons have been in this country from the very time before the Declaration of Independence. The brother of His Excellency, the Vice President of this country, was a surgeon. McGill was a surgeon. We had Trout, the first ophthalmologist in Liberia, and perhaps the first in sub-Saharan Africa. And therefore, our lecture shall be the If Nehemiah Cooper Memorial Master Surgeons Lecture. We will not we want to wear like our scalpel on two sides. Honor those who have done it, but honor everybody who is doing it. So it's a Master Surgeon's Memorial, but every year, one surgeon who has done well shall follow, and the one who bears the torch is Dr. Nehemiah Cooper, who was the first bona fide, internationally qualified surgeon who came back to Liberia and served honorably. That shall be the concern. Lastly, to the young ones, today is the tomorrow that you worried about and worked so hard for. Do not ask, why should I do this? But ask, what shall I do? And more. The future is yours because you are young and you can do everything with it. The ball is in your court, therefore play it, or we the older ones shall score the goal. Don't ask why, but what. And in all of this, we hope that this small country, small in numbers, but great in potential, shall rise and shine, and the Lone Star can fly from day to day, night after night. Thank you very much.
Liberia College of Physician and Surgeon.
Distinguished colleagues at the high table, I would like to take this opportunity to congratulate the fellows and members of the West African College of Physicians on the hosting of the 6th annual general meeting, and I think the 15th Jane Tukba lecture series. As I said, we are a very young college, started in 2013. And we started with 4 faculties. We've now increased to 7. And next year, we plan to upgrade to 8 faculties. We could not have done this without the aid, support, and continued collaboration with the West African College of Physicians. In fact, about 95+% of the faculties of our college who have trained our young doctors are fellows of the West African College of Physicians. So we thank you very much for your continued support. Liberia faces a very difficult situation. Some years back, one of our late presidents used to say that we're challenged by poverty, ignorance, and disease. And we're still challenged by these 3 foes. I recall during the early days of the Ebola epidemic, I was at the Ministry of Health. I had just come downstairs and it was raining a bit, and I was waiting under the car shelter. And a lady was mumbling by me, and she kept saying, that all these things these people are doing in this country, that's caused God to send this thing upon us. So I listened to her rant for a while, and I turned to her and I said, excuse me, this is an infectious disease. It spreads from person to person. She says, yes, you go with your infectious disease. I'm telling you that God has sent this thing. So, doctors, medical practitioners have a unique role, not only to diagnose and treat patients, but also to increase the level of awareness amongst the people of this country. Because if we cannot improve the level of awareness, we will continue to face an uphill battle. I again congratulate the fellows and members of this college. Especially I say congratulations to the new fellows who will be inducted into the college in the coming week. Congratulations for your struggle. We look forward to some of you joining the college as faculty, and it is only then when more and more of Liberians become fellows in the various faculties that the Liberia College of Physicians and Surgeons will be sustainable. Thank you very much.
Who is our country representative. He is unable to join us here today because of other commitments. He is covering for the Western UN coordinator and he's quite busy. So he has sent his greetings to the audience, and he's part of the event. And he said, I must pass his congratulations to the associations and to the colleges for making this very important event. We all know that in Liberia we have made some good progress regarding improving health outcomes, but we still have a lot of work to do. If you look at some of the key health indicators in the country, the demographic and health survey report, which was released for 2019 and 2020, it shows mixed findings. There are indicators where the country has performed relatively well, like reduction in terms of maternal mortality ratio. You find that other indicators have really stagnated, like infant mortality rate, under 5 mortality rate, and others. So we still have a lot of work to do as a country as far as health sector is concerned. We as WHO, we are really committed to supporting all the government efforts and all what the other partners are doing. Looking at the overall national development agenda for the country, the PAPD, which has clearly defined what we collectively need to do in order to improve health outcomes, but also to improve other sectors. This is also aligned to the overall UN Sustainable Development Cooperation Framework to improve social services in the country. So for WHO in Liberia, we are focusing on about 4 areas. One is addressing universal health coverage, making sure that people can access the services that they need at all times, and the services should be of good quality and they should not be impoverished while accessing services. So that's one key area, universal health coverage. The second area is around addressing health emergencies. We need to prepare, detect, and respond in a timely manner to health emergencies. We have seen the experiences from the Ebola outbreak. We have seen the experience from COVID-19 and many other outbreaks that have occurred in the country. So we really need to prepare to be able to detect and then respond in a timely manner to major public health events in the country, but also in the region and globally. And then we are also supporting work around social determinants of health, addressing the risk factors. We are talking today about non-communicable diseases. We need to address the risk factors for non-communicable diseases, and then making sure that people practice healthier behaviors. So that's another core area of work that WHO is supporting the ministry and the government in order to improve health outcomes. And then lastly, it's not least, is the work around maternal and child health, making sure that we address the major causes of deaths and ill health among mothers and children. So those are the four broad areas that WHO is working very closely with the government, the Ministry of Health and partners, including academia and other civil society organizations to address in the country. So I really like to be Liberia. In Liberia, NCDs contribute about 38% of all deaths every year. This is quite a very high percentage. And if they are left unattended to or unaddressed, we will lose so many lives by the year 2030. Commendably, Liberia is committed to meeting the global NCD targets, the 2025 target and then the 2030 target, which is to reduce 20% of all deaths from NCDs, 25% of all deaths from NCDs by the year 2025, and then to reduce by a third all the deaths by the year 2030. However, limited national progress has been made in the fight against NCDs. To achieve these targets that we have highlighted, all countries, including Liberia, must liberate on a series of key interventions that will promote multi-sectoral actions to address major NCD risks, such as tobacco use, harmful use of alcohol, unhealthy diet, and physical inactivity. Some of the key actions that WHO recommends to member states include setting time-bound targets to reduce NCD deaths, developing all of government policies to address NCDs. We need to implement key tobacco demand reduction measures. We need to institute measures to reduce harmful use of alcohol and unhealthy diets. And we need to promote physical activity at all levels. We need to strengthen our health systems through primary health care and universal health coverage. So such cost-effective and really implementable measures, they also include taxation and improving packaging of tobacco products, reducing salt content in food, especially sodium. We need to provide drug therapy and counseling to people with diabetes mellitus, people with hypertension. We need to strengthen screening and vaccinating girls and women to protect them from cervical cancer. The key health sector challenges and bottlenecks for collective actions. If you remember, we achieved Millennium Development Goal number 4. But looking at the data from the Demographic and Health Survey report, the infant mortality rate has suddenly increased over the last 7 years. It has increased from 54 to 63 per 1,000 life births, while under 5 mortality rate has stagnated. It reduced from 94 to only 93 per
per 1,000 life births. Communicable diseases, non-communicable diseases, neglected tropical diseases contribute still very high burden of disease in Liberia. In terms of retention, in terms of trainings, Liberia, if you look at the core health workforce density, Liberia has 12.8 per 10,000 population. WHO now recommends
College of Physicians, Liberia chapter, Distinguished Service Award presented to Dr. Jimmy Ola Benson, BSc, MD, GGO, LM, DPHT, Fellow of the Liberian College of Physicians and Surgeons, Fellow of the West African College of Physicians, Faculty Chair of Family Medicine, the BSCP Liberia chapter, CEO and Proprietor Benson Hospital, Monrovia, Liberia. A distinguished family medicine professional, a caring and committed community developer, and a loving husband and a father. Whereas Dr. Jimmy O. Benson was born on March 15, 1948 in Ondo, Nigeria, where he received his early education, later traveled to the United States of America, where he completed his high school education. Then attended Howard University, where he graduated with a BSc degree, majoring in chemistry and minor in biology in 1973. And whereas Dr. Jimmy O. Benson left the United States to pursue his life ambition of becoming a medical doctor by attending the AMWT School of Medicine, University of Liberia in 1974, becoming a proud member of the class of 1978. And whereas Dr. Jim O. Benson, affectionately called J.O.B., diligently served his one-year internship at the John F. Kennedy Medical Center, and then being assigned by the Ministry of Health and Social Welfare for rural service at the Talawaya Memorial Hospital in Gonjaman, Local County. J.O.B. always ready to go where I am needed, gladly left Gonjaman to take up another assignment at the government hospital in Tappan, Romy County, where he served for 3 years. And whereas J.O.B. always driven to improve his knowledge and skills, applied to the University of Ireland in 1984 for postgraduate training and pursued postgraduate diploma studies in obstetrics and gynecology, and has since taught midwifery at Lontuda Lying-in Hospital, National University of Ireland, Dublin. And whereas J.O.B. immediately returned to Liberia after his postgraduate studies in Ireland to continue serving the Liberian population with this increased knowledge and skills by serving 11 years at the St. Joseph Catholic Hospital as their obstetrician and gynecologist. To his credit for his outstanding performance, many babies were named after him, showing a sign of respect and appreciation for his patients. During his 11 years at service at the Catholic Hospital, J.O.B. had no surgical casualties and left an amazing legacy at St. Joseph Catholic Hospital. And whereas J.O.B. then carried his skills into the wider community at the urging of the community members of Outland Community, Newport Road, Painesville, his then residents, resulting in the birth of Benson Clinic, which became Benson Hospital in 2002. And whereas J.O.B. exhibited not only his medical professional skills, but also being an astute businessman, Benson Hospital is now a 60-bed hospital with 80 employees and treating about 12,000 patients per year. Conflicts in Liberia from 1989 to 2003. And whereas Benson Hospital serves as a Commonwealth district hub for vaccines and ice packs due to its central location and regular 24/7 supply of electricity, thereby providing space for freezing ice packs and vaccine storage for distribution to the smaller clinics, all at no additional cost in a national immunization program. The officers and fellows of the West African College of Physicians, Liberia chapter, are pleased to present to you Dr. Jimmy O. Benson, BSc, MD, DGO, LM, DPHD, Fellow of the Liberian College of Physicians and Surgeons, Fellow of the West African College of Physicians, a devoted healthcare professional, a loving father, and a renowned humanitarian. This noble citation for distinguished services rendered with singular honor and appreciation of your astuteness, diligence, dedication, integrity, professionalism, and above all, love for the Liberian people. We and succeeding generations shall be guided by your exceptional and venerable examples, words and deeds. Given under the hands and the seal of the Liberia chapter of the West African College of Physicians, this 21st day of October, for clarity, it was done last year. This 21st day of November 2021, Isabel V. Simbier, MD, Fellow of Liberian College of Physicians and Surgeons, Fellow of West African College of Physicians, Secretary, Angela O. Benson, MD, MPH, Fellow of West African College of Physicians, Fellow of Liberian College of Physicians, Chair, WACP Liberia chapter. Thank you so much.
Honored to call forward our new fellows who have done so well and made Liberia so proud. 100% passed in the fellowship exam. Dr. Joyce W. Batipon. None other but Professor Sunday Kineye and his team. And we say a big thank you to him and to all who have groomed, trained, mentored, guided these fellows to where they are today. But in this public manner, we want to recognize Professor Sunday Kineye and gown him. And he will be professionally know that this is his second home. We have Dr. Simbe and Dr. Macaulay gown him and carry him. Please come forward.
Thank you. Well, I can't thank you enough. Because I've been rightly pointed out, Liberia is my second home. Yes. And I strongly believe in that. Because when I came, it's complete now. I hope they will allow me to take this one. So, when I came in 2016, I'm very brave. I already had the opportunity to go and do sabbatical somewhere in Nigeria. It's just suddenly the Liberian offer came, and something in me compelled me that I should go to Liberia. It was just at that time the Ebola was just phasing out, but there was still this fear, there was this phobia. I'm sure that that chapter, as the library inspired dynamic and small chapter. I thank you all. I still recall with nostalgia in 2017 when the AGSM was added to the GNQ lecture. And we can see today is It's a mark of success. And I also recognize the General family. Sir, in 2017, I remember, I think it was somewhere at Singapore when we did the first one, and he was also there with his family. I'm so delighted that internal medicine faculty has been a best setter. And let me also not forget the role Professor Njor played, Joseph Njor. He laid the foundation. Also, Professor Rosita Masha, she's not here. They were the people that made sure that I came to Liberia. I also recognize the synergy and collaboration with SCPS. Please, we should keep the flame on, because that relationship is actually what led to all these successes we are celebrating now. The role of SCPS is definitely part. I recall the first accreditation in 2017. It was actually SCPS that invited the WACP accreditation team. So today we have members, we have fellows by examination, and all of them have been pointed out here. Dr. N. Wachekwa, Dr. Philip Island, Dr. Joyce Patekwa, and Dr. Emmanuel Lekimba, and other members also. So I congratulate you all. Now, what's the message you have to take home now that we need to consolidate and sustain these achievements. Very, very important. And let me inform you that one thing that has kept Nigeria strong is the esprit de corps among the professions. Yes, I know, there is nowhere in Africa where we have other excellent leaders. But the professionals are very important. Once the professionals are together, they will help to sustain the country. And it cuts across. You will agree here, a lot of Nigerian banks in Liberia. So it is among the health professionals, the doctors, the nurses, the pharmacists, the surgeons, and the lab scientists. We are very much together, yes, and that has helped to sustain the health manpower and the various health industries in Nigeria. We may not be there, but at any time, we'll fall back on it. So, and how do we consolidate and sustain? We must motivate our health professionals in the right environment. That also has been pointed out here by Professor Golda. Very, very important, because if you don't motivate them, a lot of people will lose, that interest, and that wouldn't be good. With adequate motivation, there will be further training. Because now, internal medicine has 4 consultants. I can assure that a department that has 4 consultants, that department cannot fall again. So, but we need to motivate them. Like these young fellows, they need to be absorbed in the medical school. Yes, so that they can form the foundation. Even our integrated curriculum we just launched very beautiful curriculum. We need these young fellows to be able to implement it. Because all over the world, the curriculum is not really all that a problem to draft. The biggest challenge of curriculum is implementation. Yes, and I believe that we need these young fellows well motivated to be able to implement that curriculum. And of course, with more training, we are going to have a critical mass. Once you have a critical mass of fellows, of specialists, you can be sure that